We can update some vaccine answers right now, as we have on Wednesday mornings several times over the last month, and that is with MU healthcare physician Laura Morse, who's on the phone with us. Dr. Morse, good morning. How are you?
Good morning. Doing great.
So let's talk about how things went last week when there was the mass vaccination on Thursday and Saturday done over at the football field on the east side at the University of Missouri. Things go well there?
Things went great. We were excited to really kind of put to test our high throughput system, and we were able to vaccinate over 2,000 people on each day, Thursday and Saturday. Went really, really smoothly.
So the next one of those would be when, if the schedule holds?
Next week. So the schedule with the high throughput vaccination sites is every other week delivery. So we won't receive any more doses, but anticipate 4,000 Moderna doses the week of the 15th. And we will repeat that same schedule 2 days with about 2,000 folks on each one of those days.
Now you have, we've talked about, and as I've tried to mention as often as we can, you have a sign up through MU Healthcare, so people can sign up saying, I'm ready. Whenever it's available, please let me know, and I'll be happy to come and get a shot. And then also the county has its sign up, and there are other ones. What is your advice to people in regards to the multiple sign up sites that there are right now?
Yeah, so the landscape with that is changing and kind of evolving, and I recommend folks sign up in as many places as they could reasonably expect to actually get vaccinated that they could travel to. And certainly MU Healthcare is partnering with folks in our community, including our county, and working with other partners to perhaps merge lists and make sure that we are providing access for everyone in our area who wants the vaccine and is eligible. But that muhealth.org website has our list, and that is growing, and we're filtering that list to make sure we're inviting the folks who are eligible, and we will keep working through that list. It's going to be a while based on the number of doses that we get, but if you're on that list and you're eligible and we get doses, we will keep contacting.
The issue right now is receiving doses. What are you hearing as far as maybe an increase in what would be available, especially to I understand the news today that we've been talking about on our news story is that Sam's Club and Walmart are going to get some doses of vaccine. They'll start to administer them through their pharmacies. There have been other pharmacies. I think it's scale more than anything that maybe people need to understand when they hear of these others. That doesn't mean there's going to be a lot of vaccine available through those sources.
Yeah, absolutely. Right now, what we know is that those will be relatively small-scale operations here locally. Of course, those pharmacy networks and big box stores like that are distributed pretty widely across the country and our region. So you can understand why some of those strategies might make sense to think about when we need to roll this out to everyone. But certainly our MU Healthcare site for that high-throughput vaccination, very quickly and efficiently vaccinated 4,000 people over the course of a couple of days. So in this case, what we're really limited by isn't any vaccine going to Walmart or another store like that. It's really being able to get, thousands more doses for us to administer and the other sites in our state that are set up to do this high-throughput vaccination as well.
I think you described it well a week ago, and I'd like for you to describe it again. The University Hospital, MU Healthcare, it is one of the hospitals designated by the state as receiving a lot of this vaccine. There are not every hospital is getting that, so what does that mean as far as this area is concerned?
Sure. So the state of Missouri divided up the state into regions based on your highway patrol troop, right? So we're Troop F, kind of here in the central mid-Missouri region. And they designated just a few hospitals that were already set up and had capacity to do these high-throughput clinics. And then they said, we'll give you doses on a recurring basis because we know you can get those shots in arms. And it certainly doesn't mean that other health systems are not receiving any vaccine, but we're really trying to partner here in our region to make sure that we aren't excluding anyone just because we were named as that. We are certainly not limiting these vaccines to MU Healthcare patients. This is open to the community, and folks really need to sign up on our website to make sure they can get invited to one of these high-throughput clinics.
Down the road, do you expect a cooperation between MU Healthcare and like Boone Hospital?
Absolutely. This is a community goal, right? We are partnering with lots of agencies and groups within our community to make sure we're going to reach all the folks that need the vaccine. And again, that we're not putting any kind of restrictions or limits on who can receive the vaccine through this site. We're honored to be able to stand up this high-throughput clinic and be able to provide access in the community. And we will absolutely cooperate and expect cooperation from others, including Boone and including the health department, for examples here within our community.
I think you proved last week that you can go through a couple of thousand within a 12-hour shift, and I think you could have handled more than what you were able to do on that Thursday and Saturday.
Yeah, we've really ramped up staffing. This is a clinic that is looking at a little bit longer-term operations, and even though we're only utilizing a couple of days a week based on the number of doses we have, we could certainly expand that if needed. And despite the snow, right, so those were kind of cold, snowy days, the weather tried to get in the way, but actually went off just extremely smoothly, not a single dose wasted.
Yeah, and I saw that Poplar Bluff, which was supposed to have one of the mass vaccination sites, and that would be administered by Missouri National Guard, I think they, because of weather, were unable to hold theirs. I'm not sure what day that was supposed to be, but of course that's out of our immediate area, but that does tell you that weather can impact in some situations. What do you want to leave us with, Doctor, as far as anything in regard to vaccine information? I don't mean just the dosing and the administering the vaccinations, but also, is there any development that you would say, folks, feel good about this? It's moving in the right direction. What do you have to leave us with today?
Yeah, I really do want to emphasize the positivity of all of these developments. It can certainly feel intimidating or confusing to hear that maybe there's multiple lists I need to sign up, but honestly, what this means down the line is increased access to the vaccine for everyone who needs it. And everyone in our community deserves the vaccine. And eventually, we're still talking about restricted groups of patients that are eligible and small numbers of doses, but over time that's going to change. And so we still need to have the optimism that this vaccine is here to return us back to normalcy. And to have a little bit of patience as all the lists and signups and everything moves forward, because the vaccines that come to the state are getting in arms, and that's the most important thing right now. That's
good. I appreciate that. Also, I might just note, we received this from MU Healthcare yesterday on a release that visitation or visitors will be allowed also at MU Healthcare. There's still restrictions, but it's an easing up slightly of some of those restrictions so that those who are in the hospital are going to be able to have one visitor in most situations. So that's good news also, because the numbers are going in the right direction.
Absolutely, they are, and we're optimistic about that.
Thank you so much for your time. Look forward to our next visit.
Thanks. Sounds great. Have a good day.
You too. Physician Laura Morris with us from MU Healthcare. This is KFRU.